Hello everyone, this is Dr. Adip, consultant physician, DRM Hospital, Mysore. Today my topic is on type 2 diabetes. As you all know what diabetes is, but the problem is when should we start the treatment, when should the patient come to the hospital is a big question mark every day. People above 50 years who have no symptoms also should get annually sugars checked in the form of fasting blood sugar, postprandial blood sugars and the HbA1c. What is HbA1c? HbA1c is nothing but the 3 months average of the sugars. If you have symptoms, you have to come as soon as possible, not to wait for 1 year. But in case if you are asymptomatic, you have no symptoms or no family history, to come once in a year and get this test done. Okay, once you are diagnosed with diabetes, what is the next step? You have to, based on the blood investigations, what we call it as fasting blood sugars, postprandial and HbA1c, you have to start the treatment according to it. And how to decide which patient should go in for insulin therapy and which patient should go into oral hypoglycemics. So the question is based on the 3 months average and FBS and PPBS. Patients whose HbA1c is well controlled, that is less than 8, should go in for type 2 diabetic medications, oral hypoglycemics, what we call oral hypoglycemics in the form of metformin, sulfonylureas and DPP-4 inhibitors. But the question is when to start insulin. Insulin should be started in patients who have comorbidities. Comorbidities in the form of cardiac issues, renal issues and ophthalmic issues and neuropathy. So we have to decide when to start insulin in this format. So whether we have to start insulin or not to start insulin. The advantages of insulin and disadvantages of insulin have to be categorized and then start the medication as per it. So once we come with the diagnosis of type 2 diabetes, whether it's a newly detected or an old one, and if we have neuropathy, nephropathy or retinopathy, the best way of medication is to start insulin. The reason is it prevents the progression of further disease of the neuropathy, nephropathy or retinopathy. What happens if we don't start? The disease progression is fast and the patient may have complete neuropathy in the form of tingling, pain, numbness and not able to sleep in the night, and he has repeated visits to the clinic. And about the nephropathy, he may progress into renal failure eventually if the sugars are not well controlled. And the next problem is retinopathy. Once the retinopathy sets in, if the sugars are not well controlled, the patient may go into complete blindness. To prevent these things, we have to start with insulin. So the question is, can it be prevented only with oral hypoglycemics? Yes, provided there is a complete lifestyle modification. If there is no complete lifestyle modification, the sugars start building day by day, and when the sugars are not under control, the retinopathy progresses very fast, leading to complete blindness. So what I give a message through this video is, if your sugars are not under control, come to the hospital every year, get a routine checkup in the form of FBS, PPBS, your renal function test and HbA1c, and monitor the sugars time to time so that we prevent the progression from microvascular disease to macrovascular disease. Microvascular disease may be prevented to go into further progression to macrovascular only when the sugars are well controlled. So there are no clear cut indications where a person can say my sugars are well under control or my sugars are not going high, because diabetics most of the time is asymptomatic. So the symptoms don't eventually come up, because the body tries to fight on its own. So you have to get into regular checkups. The regular checkups in the form, if your sugars are very much uncontrolled, you have to come to the clinics every 3 months. Once the sugars get into control, come every 6 months, and once your sugars are stable and the doctor has fixed the medications, then it is enough if you come once in a year. So my the message to the people with this video is, we have to prevent the macrovascular complication, which is one, there is financial burden, second, the burden goes on the family, and third is we ourselves, the patient himself has to suffer. So for that we have to have regular checkups in the form of blood testing, and if you have developed macrovascular complication, the respective departments have to take care of the system. Like if nephropathy has set in, we have to involve the nephrologist and he will take care of the nephro part. If retinopathy has set in, our main criteria should be to prevent the blindness, so that the patient can lead a healthy life. So for all these things, we have to have a tight sugar control. That is possible only if the sugars are not controlled with oral hypoglycemic drug. We have to go in for insulin. So the message with this video is, have tight sugar controls in the form of diet, lifestyle modification, avoid sedentary lifestyle and take your medications properly, and visit your clinician time to time so that you can lead a happy life. Thank you.